for you as a potential patient, to know that acupuncturists are highly trained in Western medicine understandings. They're not sitting there in acupuncture school just learning like mystical, spiritual concepts, sitting there meditating all day. Okay, so let's say you as a patient just have one problem going on. You have a back pain. Who do you see? Do you see a dry needling person? Do you see an acupuncturist? If a patient came in and saw me from back pain, some sort of musculoskeletal issue, the diagnosis process would be more leaning towards a similar pathway to what a dry needling person would be looking at, rather than the Chinese medicine process. So we have this concept of internal medicine and external medicine. So internal as in the zang fu organs, so the organ systems of your body and the pathological mechanisms and the issues that can go on, like so let's say you get a cold or a flu or something like that. Now that's one system of understanding the body, but then you've also just got the external aspects of your body. So let's say you fall over, you didn't get a cold, or like you don't need to use the same system that understands you getting a cold or a flu, because you fell over and now you've injured you've broken your ankle or something like that. Like as a herbalist, I might tackle those issues, those musculoskeletal issues. Sometimes I can tackle them from an internal medicine perspective, especially chronic problems. And that's what makes it different. If you see a Chinese medicine practitioner, they've got the option to use both. So they've got more techniques in their arsenal that they can use for you, rather than just one thing. We're saying, well, we have to use this one trigger point therapy where we're going to put the needle in and expect that trigger, that twitch response and that kind of thing. That's all we can use. So look, that doesn't always work for every single condition. There's some things where, especially for acute problems, it's very good for that sort of stuff, like it's recently happened. For things that have been there for a long time, we might need to employ other techniques as well. Or let's say if that doesn't work as well, it's giving you a certain result, so the pain might be going down a little bit or getting less, then there's other things an acupuncturist can use for you, which gives you as a patient a huge amount of benefit of things that you can access. So what I want to do is expose the misconceptions that are out there so that you as a potential patient can understand that. And for you as a potential patient, to know that acupuncturists are highly trained in Western medicine understandings. They're not sitting there in acupuncture school just learning like mystical, spiritual concepts, sitting there meditating all day. At least a third, if not half of the course now, I mean, I'd say, because I teach at one of the bigger colleges, in Australia, almost like at least a third is dedicated to Western medicine subjects. And then there's another probably third of the course which places a huge amount of emphasis on just the scientific rigor of things. So they have to learn scientific methods, a lot of social sciences, and also there's, they do a whole unit just in academic research methods. So the expectation of students when they treat, when acupuncture students are in a student clinic and they're going to treat a patient, there's a higher emphasis. And in the past couple of years, there's been more, at the college where I teach, certainly, there's been more emphasis on students coming up with those ideas based on academic research papers rather than even just textbooks. So they can use textbooks for sure, but coming up with ideas like treatment ideas based on research protocols. So to say acupuncture, to have this implication that acupuncture isn't scientific it's just a crime against our profession. So I have to kind of stand up and say something, otherwise I feel like I'm going to explode here. A big difference for you as a patient when you see an acupuncturist versus a person who does dry needling is an acupuncturist can do the dry needling. Okay, so let's say you as a patient just have one problem going on. You have a back pain. Who do you see? Do you see a dry needling person? Do you see an acupuncturist? If you see an acupuncturist, they may use the techniques of dry needling, but then they've got other techniques that they could use. They might use moxa, cupping. They could use different kinds of points on you, different areas if that was warranted and needed in that treatment strategy. Whereas a needling practitioner can only do the dry needling technique, so they can only use that one technique on you. If you have more than one health problem going on, now the majority of my patients do have this, so they might have a back pain or a neck pain or something like that, and then they've also got digestive problems, or they've got other health concerns, they want to get pregnant, or they've got this just general health problems and maybe just feeling run down. And to be honest, we don't go to the doctors as often as we do for a checkup. We should make sure that we're healthy. Acupuncturists can keep you healthy in that way by checking your pulse and by using the internal medicine systems of Chinese medicine. Now, this is so now they're not using the dry needling framework, they're using the Chinese medicine framework. But by using that framework and assessing your body in that way, then we can treat those, or we can treat your body to help it get better and to help to assess or to work towards treating those problems. Sometimes practitioners can't treat everything at once. They may have to just go, right, we need to treat this back pain first, or we need to look at this headache issue first, and then we can start looking at your guts or different problems that are going on there or things like that. Sometimes those things are really interrelated, and you may have had systemic treatments before where a doctor said, oh, this is related to this is this, and a Chinese medicine practitioner can actually see the intermingling of those things together. That's to your benefit, because your body is one body, and that's one thing where Chinese medicine sees that it's all interrelated. So let's say if you come to me as a patient, you say, Marie, I've just got this back pain, please, I just want you to treat that, I want you to fix that. So I will assess you very broadly in a Chinese medicine way as well, because that's what I do. So I will check your pulse, and it's sometimes patients want to take herbs for a particular thing, and maybe they haven't mentioned that up front. They might say, I've got a back pain, but then when you ask them things or check their pulse, you realize that there's some other stuff going on, and they might think, oh, I've had this diarrhea forever and that's just normal for me, and then it comes out in the wash that, yeah, hey, that's not really normal, and we should work on fixing that for you, or some other health concerns or things like that are imbalances that are there. A Chinese medicine practitioner can pick those things up, whereas if you go to a dry needling person, they're not going to really care about your guts or other issues for you. But I understand that patients want to be treated for the main thing that's concerning them, so that's what I have to focus on. And if dry needling is the best thing to treat that, that's what I'm going to use. So if when I palpate the muscle where the pain is, if I find a trigger point and I think this is the best way to treat that. Now, there's some cases, because I've already checked the pulse and I've realized that constitutionally dry needling isn't the best treatment for this person. Dry needling may actually make them feel worse. And it's only been in my experience of treating patients over like 17 years where I've had some patients where I've treated them locally using those dry needling approaches, and it's actually made them worse. Like it has twitched the muscle and it has caused that inflammation response. And okay, yeah, they got better after a week or a bit of time, but initially they didn't feel very good, and it was overstimulating them in that way. And then over time, I've learned other techniques, there's other ways of treating that. So the benefit of seeing an acupuncturist over just a person who does dry needling is they can use dry needling if they choose to, or if they feel that's appropriate. And you as a patient, if you're informed and you know these different techniques exist and that's what you want, you can request to have that treatment with that practitioner and discuss those things with them. And certainly I've had patients where they've said, where I've said, look, I'm not going to needle your back because of this reason, because of blah, blah, blah. And this is the reason why. And then they understand why I've not done that, because if you've got a pain and it's in your back, and so you sort of would expect someone to treat your back, and you might be a bit like, oh, why are they putting needles in my hands and my feet only? Like if the pain goes away, most people don't care. Like they're just like, well, fix the pain, so I don't really care how it worked. But yeah, there's often conditions where treating them locally, which is dry needling, has to treat you locally. It's got to palpate where that pressure, that tight trigger point is, and it's relying on knowledge of muscles and nerves. But you have to understand an acupuncturist has that knowledge of muscles and nerves as well. Believe me, they have to understand all that, otherwise they wouldn't be able to do acupuncture, they wouldn't be able to stick needles into your body. So I hope this series has been informative for you and interesting to you. Please leave a comment in the comments below. I'd love you to subscribe to my channel, Marie Hopkinson, and it really helps me if I get more subscribers on my channel. It can help me spread the word. These videos get shown. So if you put a like, you put a comment, you subscribe, then that helps YouTube show my video to more people, and so that would really help me. So if you've enjoyed this video and that's been useful for you, please like and subscribe right now. That'd be great, and I hope you have a great day. And yeah, if you want me to make a video about a particular topic, then put it in the comments, and yeah, I'll do the best I can to do that for you. Thank you.